guys. I think we'll go ahead and get started here. This is the second time we're having this presentation, the 7 things that knock digestion out of whack, and we're going to be recording it for my learning. So if you like it, if you know anybody else that might be interested afterwards, just let them know that it will be posted up there. So this is a topic that's really near and dear to my heart, digestive health. I'm a dietitian, and when I was 11 years old or so, I started to get acne. And I ended up getting really, really severe acne, like the worst case that my dermatologist had seen. And then was put on antibiotics for about 10 years for that until he kind of fired me because he just didn't know what else to do. And I still had acne. So it kind of led me on this journey of, studying nutrition, trying to figure out what could be causing this. And then, of course, the antibiotics really messed up my digestion. I got irritable bowel syndrome. I got, low energy, some thyroid issues, some brain health issues, depression. And kind of as I went through that whole journey, corrected things, fixed nutrient deficiencies that I ended up getting it from all those antibiotics and having such a bad gut. I'm feeling great now, and I just want to share some of the knowledge with you that I've kind of learned over the years and from being a dietitian in my studying. But I will say the one thing that ended up helping me for the acne, the thing that I think helped the most, was cutting out dairy, which I ended up having a food sensitivity to, and that made the biggest difference. So if you suspect a food intolerance, sensitivity, we did do a presentation on that a couple weeks ago too, and that one will also be up on my learning. But today we're going to talk about things that can cause digestion to go out of whack. My name's Ashley Oswald. As mentioned, I'm a dietitian nutritionist. I work here at the hospital, but more so out in the community where I help people with issues like this, with irritable bowel syndrome, with a lot of those just chronic diseases, the same things that we'll see in the hospital. Symptoms, gas, bloating, diarrhea, constipation, high blood sugar, low energy, just a lot of those things that can be helped with a nutrition approach. So I did my training at the University of Minnesota, Twin Cities, and then I moved to Boston and studied at Brigham and Women's Hospital. And then I moved back here. That's when I got my first job here at Regents. And over the next few years, I've moved to California, worked out there in functional medicine, and did a couple more years of training in this more functional integrative medicine space. So just the disclaimer, this is nutrition information today. For anything specific, check with your healthcare provider because we are all different. And today we're going to talk about the functions of the digestive tract, so you should leave here with a better understanding of how our digestion works. We're going to, you should leave here recognizing how impairments to digestion can contribute to disease, and then we'll talk about those 7 root causes that could cause digestive dysfunction. And I always like to start with kind of this little food for thought piece. Do you guys know who this is? No? Her name's Iris. She's 97 years old, still living in New York City, and she's a businesswoman and a fashion icon. So she's still doing what she loves at the age of 97. I think it's just good food for thought because as we get older, we don't necessarily have to kind of go downhill. And the key to that is thinking about, what can we do now to maintain and optimize our health now so that we can maintain it for as long as possible to just help us feel well and do what we want to do as long as possible. So as we go through this presentation, I would just kind of encourage you to think about what do you want your health for and what are you able to do now? What resonates with you through this presentation that you could start implementing right away, maybe dig a little deeper into that you think could really make a difference for you. We all know ourselves best and what, that suspicion of what we think is going to help us the most. So let's just start with a little bit of true or false. Bloating is a normal part of digestion. How many of you guys think that's true? And then false? Yep, false. Do you guys know how to figure out if you're having bloating? Because sometimes, I know clients tell me, it's kind of hard to know, especially once you kind of adapt to it over the years. But what you can do, if it's bloating that's likely related to food, it should get better in the morning because you haven't eaten anything usually overnight. So measure around your waist in the morning And then do that same measurement at the same part of your waist at night. If it's greater than an inch, then we could say that's bloating. And we'll want to dig and figure out, what's causing that. But how many of you guys yourselves or somebody who has digestive issues? Probably, yeah, pretty much everybody. It's estimated about 1 in 6 people are struggling with digestive issues. So this topic, today I think is really timely, and I'm excited to be here. So let's just do a quick run through first of how digestion works, just kind of like the overview, and then we'll dive into those 7 root causes. So digestion actually starts in our mouth. We chew food, chew properly, and we have this enzyme like amylase that will get released to help start the digestion of those carbohydrates. So chewing is the start of our digestive process, and then it goes down our esophagus. And there's this thing called peristalsis, which is just this kind of pushing mechanism to push food down our esophagus into our stomach, where we should have plenty of stomach acid to help break down the food. So that stomach acid helps to break down those proteins. We have things like intrinsic factor that can help pull vitamin B12 off of our food. And then some other things just to help that churning part of breaking food down. And our stomach's like a reservoir. It's like a holding space, so our body can have some time to really start breaking that food down. And then it slowly trickled down into the small intestine here. So that word, the duodenum, is the first part of the small intestine. Ileum's the second part, jejunum's the third part. But those 3 words are all the small intestine, this one right here. So our small intestine, believe it or not, is 20 feet long, which is pretty amazing. And we have these things called villi in our small intestine. They're like these little bumps. So if we flattened all those ridges out, it would cover a tennis court. It's huge. That's where most of our food is absorbed. So a lot of our vitamins, minerals, proteins, carbs, fats. It's, those villi, they serve a purpose because it helps increase the surface area so that we can better absorb our food. And then it goes down into our large intestine where some things like water, some vitamins are absorbed, but not as much. It's about 5 feet long, larger in diameter. And then, of course, it comes out as stool. Have you guys seen this before? The poop chart? Or it's otherwise called the Bristol stool chart. I won't make you tell me which one you are, but we'll just kind of go through it together. We have type 1 to type 7. Type 1 up here it's leaning more towards like that constipation when it's really straining, hard to have a bowel movement, and it's just really small, hard stool. Down here to 7, which is entirely liquid. We have some subtypes. So undigested food particles could be seen in the stools, or it could be fatty, meaning that we're not absorbing fat properly, usually if it's floating like that. And so ideally we want to have a type 3 and 4. And I put this up here because this can be a really good way for us to even recognize if we might be having a digestive issue. So if you notice that you're having stools that are floating, we want to dig deeper and figure out why that is, just so we can, optimize our health. So I told this story in a different presentation, but up on the 6th floor, there was a while where they had this printed, and they had a little tally on the side. So people were just telling what number they are. And I joke that you could do that as a good team bonding exercise. So what should having a bowel movement feel like? It shouldn't hurt. It should pass easily. A lot of times people have a bowel movement in the morning. Again, shouldn't hurt. About 1 to 3 a day is normal. So if we're having a lot more than that, or going multiple days without one, even more than 1 day without one, having a lot of that gas and bloating, diarrhea, constipation, that's just a sign that something's not working right. So now that we kind of have a little bit of foundation, we'll we'll dive in and talk about the 7 things that can knock our digestion out of whack. And so, I'm sure you guys knew I was going to talk about this one today. The standard American diet, otherwise known as the SAD diet. And when I say diet today, I just kind of mean the foods that we eat. I know diet can get a bad rap with, restriction, but when we talk about diet, it's just the foods that we're eating in a day. So what is the American diet? It's usually a lot of these foods that are low in nutrition. It's a lot of higher sugar, low vitamins, minerals, low fiber, kind of like the brown foods that you might see some kids eating if they don't really like the vegetables and such. This is work by Peter Menzel. It's called Hungry Planet, and he went around taking photos of what people eat in a week. He was on display at the museum at the U of M many years ago, and he actually has a book out too. But these are just 3 of the places that he went to. So we have California, Egypt, and Ecuador. And can you guys notice the differences? Yeah, a lot of whole, real foods, a lot of color, a lot of foods that are higher in fiber, have a lot more of those micronutrients, of the vitamins, minerals, phytonutrients in them, compared to us up here, this California family, and this is pretty standard, I'd say, where it's a lot of cereals, maybe some vegetables, like a little bit of broccoli, a little bit of potatoes, some bananas, but it's mostly this more processed food. So, we need that fiber to be food for our gut bacteria, and we'll talk about that as we go a little deeper into the presentation. But all this fiber that these individuals in this picture and this picture are getting, it's food for our gut bacteria to help them thrive. And that fiber also helps with the movement of our intestines, so it can really help prevent things like constipation. So I would say, when thinking about the opposite of the standard American diet, kind of just think about what your grandparents would have eaten or what you can find at the farmer's market. It's usually a lot of good quality local meats and vegetables and fruits, and if we're eating in season, the food tends to be picked closer to when it's sold, so you're going to get just more nutrients in that food versus the tomatoes that are picked in California like a week or 2 before they're ripe and shipped up here when they're still green. This one I think is also really interesting. You can go on nationalgeographic.com, what the world eats, and it actually shows through the years these graphs moving as far as kind of how it's changed over the past decades. So I just put 2 of them up here. I have the world compared to the United States. And as you can see, us compared to the world, we're eating almost 1,000 calories more. And look at the sugar and fat category, so much bigger. And certainly not all fat's bad. We know there are good fats, there are less healthy fats, but that, along with our produce section, is much smaller. So produce being tending to be those higher fiber foods. And we have research showing how the foods that we eat can affect our gut. So this one is an anti-inflammatory diet as treatment for inflammatory bowel disease. So that's ulcerative colitis and Crohn's disease. And it was basically an elimination diet, kind of moving more away from that standard American to just a lot of whole, real foods. So people were cooking a lot more, they're getting a lot more produce, and they cut out a couple of the common food sensitivities. And they found that there was really good improvement in IBD with this eating. And it was people who had had IBD for, I believe, 19 years on average. So not new. And look it up, but some of them, I believe, were even able to start tapering down on their medication because it was helping them so much. And then this one here is talking about how the Mediterranean diet helped reduce pain and improve physical function for people who were suffering from rheumatoid arthritis. So talking about how the foods that we eat can impact our gut, and that can impact more autoimmune issues in our body, like this arthritis. You know, who thought that looking at the foods we eat connected to our gut health could impact our joints, but it can. And the good news is this paper talks about how the foods that we eat can and does change the type of bacteria in our gut in a favorable or unfavorable way. And it just takes a few days for that change to happen. So if we can change the foods that we eat, if somebody's eating a more standard American diet and they change it to having a lot more fiber in their diet, a lot more of that plant produce, etc., like we talked about, they can have differences in their gut bacteria in just a few days. So this kind of just goes through and talks about how that Western style, more standard American diet, lower in the fibers, higher in the sugars, has been tied, and we have research on connecting it to things like obesity, joint disease, depression, non-alcoholic fatty liver disease, insulin resistance, and even metabolic disease. And this is kind of the pathways that can affect us in. So number one, looking at the foods that we eat. Number two, nutrient deficiencies can affect our gut health. So like we talked about, a lot of our nutrients are absorbed in that small intestine space, that 20-foot long small intestine. And if we have any sort of damage there, from a lot of things can be causing damage in our small intestine, even like food allergies, food sensitivities, if we were on antibiotics, if certain medications possibly. But if there's any sort of damage, it could be preventing us from absorbing nutrients, like if we're having a lot of bloating, gas, and things, could be preventing nutrient absorption. And then we can get deficiencies. And all these nutrients have research behind them showing how and why they could be affecting our gut health. So if you want to know if your medications might be contributing to a nutrient deficiency, you can go to mytabin.com and just type them in, just to kind of bring some insight. Because for example, if someone's birth control might be putting them at higher risk for magnesium deficiency and they're noticing that they're getting some eye twitching, it's pretty safe just to supplement some magnesium for a couple weeks and see if the eye twitching goes away, which it often does. So, the importance of working with someone knowledgeable in this is definitely key, but you can at least go to mytabin.com, type them in, and kind of bring some awareness to what might be contributing from that end. And then from, just your gut's not absorbing foods properly, or if you've had any period of your life where you are eating a lot of more standard American foods and maybe not eating enough of foods rich in these nutrients, that could be causing it as well. So if we just look up here at zinc, it talks about how zinc has been shown to decrease intestinal permeability, which just means if the spaces, there's a 1-cell thick wall in our intestine, and if those spaces are damaged and too permeable, it could be causing some of those more autoimmune systemic issues. So it helps to decrease that, maintains integrity of the intestinal wall, especially when inflammatory chemicals compromise that lining, and it works in conjunction with vitamin A. So these nutrients, they can actually be tested in the white blood cells. This is a lab that does it, SpectraCell, which is a good way of testing them because it's more of a storage form just versus taking a blood level. Or I've had people who want to trial a multivitamin for a couple weeks. Check with your care provider. Sometimes it's not appropriate if people have different chronic disease states. But you can trial that for a couple weeks, see if it makes a difference. If someone truly is low in a nutrient, it usually takes a bit more than what's in a multivite to replace it. If you wanted to learn more information and look at more research about nutrient deficiencies, SpectraCell has a whole online library. I'll have a reference slide at the end, but there's so much on the library that I just put this link here instead. So number 3 here is lack of digestive function. So at the beginning, we went through and talked about how we needed everything to be working properly for digestion to happen. We went through, you know, how food passes through our body. So as you can imagine, if our stomach isn't making enough stomach acid or is making, you know, too little or too much, it could be causing issues. If someone's on like a proton pump inhibitor preventing their stomach from making acid, it could put them at risk for nutrient deficiencies, which could have some of those other downstream effects. If we had our gallbladder removed, or if you know anybody who had their gallbladder removed, you probably know that they have trouble absorbing fat. Fat malabsorption can cause those floating stools, and of course it's not good if we're not absorbing any fat in our diet, because we need that fat in order to make sure our cell membranes are really strong and healthy, and it has a lot of other really important effects in the body. Enzymes, so our pancreas releases enzymes that help to break apart food. So if it's not doing that properly, that can be causing issues more downstream as well. If we're not making enough stomach acid, that could be contributing to the pancreas not making enough enzymes, and that could be preventing us from breaking down and absorbing foods properly. And then sometimes people have issues with like bacterial overgrowth or yeast overgrowth, and that can further, you know, affect our motility and prevent nutrient absorption. And then lastly, our large intestine, that's where most of our bacteria are. It's that microbiome. So we're going to talk a bit more about that as we move through this presentation, but if our microbiome and those bacteria in our gut are out of balance, we know that that can affect how they kind of ferment and further break down foods. But we'll talk about that in a bit. So intestinal permeability. What do I mean by that? So it goes back to that gut lining that we talked about is just one cell thick. And Time magazine actually came out with an article recently on it. Leaky gut, intestinal permeability. People are kind of talking about the same thing there. So this article has some good information if you're wondering how different medications might be affecting your gut health, and kind of just talking to your provider if you have any concerns. But as far as what we're going to talk about, this is that one cell lining of the intestine, and things are supposed to kind of flow through because we need to get those nutrients from our food into our bloodstream. But if there's damage, which can be caused by, these are a few things: stress, infection, antibiotics, poor diet. It could be making it too permeable, and that's where some of those autoimmune issues could be coming from, and why, like that study we talked about with the arthritis, why we could see improvements in arthritis by just looking at the foods that somebody's eating. And then we know that there's this gut-brain connection. And so this is just mentioning how we might have some neuroinflammation, brain inflammation, that could be caused by gut inflammation or a disrupted gut barrier. So if you want to learn more about this, Dr. Fasano is doing a lot of this research, and you can just look up his name. This is a nice article kind of talking about some of the mechanisms involved. And if you guys put your email address down, I will send out the slide deck afterwards. So, all right, what help us support our gut barrier? Well, definitely the foods that we eat, and our genetics can kind of play a role in that too, as far as if someone has food sensitivities, food allergies, which could cause damage. And if you're interested in that, again, we have that other presentation. But some things like this low-fat nut diet, has anybody heard of that? Yeah, it's helpful if people are having a lot of gas and bloating, diarrhea, constipation. They're just these short-chain, really quickly fermented carbohydrates that can cause issue in people. And it's kind of this learning diet where you cut them all out, add them back in to figure out which ones are triggering your symptoms. A lot of interesting research coming out about probiotics, and it'll be really fascinating just to see what we learn in the upcoming years, but we're just really understanding the tip of the iceberg here. Our gut bacteria, we have 10 times as many gut bacteria as human cells in the body. So it's pretty incredible. It really kind of begs the question, what are we, like human or bacteria? But there are selected probiotics that we know can help to kind of heal that lining. Prebiotics, probiotics, and then some of these things like short-chain fatty acids. And this one we actually get from eating fiber. So there are certain fibers that the gut bacteria will eat, and then they produce these byproducts such as the short-chain fatty acids. One of them in particular called butyrate, which is really healing to that gut lining. Again, help prevent this sort of intestinal permeability damage. So number 5 here, unbalanced microbiome. So as I mentioned, we have about 10 times as many bacteria in our body as human cells. There's 100 trillion microbes, we estimate. It's pretty amazing. Most of them are in our large intestine. And dysbiosis is just a term meaning that we have more harmful than beneficial. Not enough diversity. You know, when we're born, that's when we get the most of our microbiome. It's kind of the babies coming from the mom's vaginal canal is when we get a lot of it. So, you know, with C-sections, they're starting to maybe soak. There's some research going on where they put a rag in the mom's vagina and then rub it on the baby after it is born C-section. And they're finding that can be really helpful just to help set a baby up for having this good microbiome right off the bat. And then we also know that breast milk has some probiotics and prebiotics in it. So the baby's getting some good, helpful bacteria from that breast milk too. And then as we kind of go through life, we should be eating some foods and we should try to expose ourselves to good bacteria as well. So we'll talk about fermented foods, and that's one way to do it. But you've maybe heard how kids should kind of get out in the dirt and, you know, be in nature. So that's kind of what they're talking about, to get exposure to some of those bacteria, not be in such a sterile environment. And our bacteria communities, they've been linked to weight and asthma and acne and a lot of other things. And again, I think we're just going to keep learning more about which ones are good, which ones are bad, and how do we really kind of modulate this environment in our large intestine. When it comes to antibiotics, this article talks about how 1 7-day course of an antibiotic was shown to affect the people in the study's microbiome for 2 years. So 1 7-day course affected the microbiome for 2 years. It's pretty wild, and I mean, that's why I think it's just so important that we do everything we can to try to support our microbiome by getting enough fiber, by getting in those fermented foods and those good bacteria that we get from the fermented foods, which leads us up to this topic of what are fermented foods. So this is a list. Have you guys heard of any of these before? Yeah? Do you guys have a favorite?
Kefir.
Kefir. Anybody else? Does anybody make their own? No? So it's really easy to make your own. I'll tell you kind of quickly how to do it. All you have to do is take some vegetables. Usually root vegetables work best. And for 1 pound of vegetables, use about 1 to 2 teaspoons of salt. Sprinkle the salt on the vegetables. So carrots work really well this time of the year. So sprinkle about 2 teaspoons of salt on 1 pound of carrots. Let it soak. The carrots will kind of sweat a little bit, release some fluid. And then just put it in a jar. You can use really anything. Mason jars work well. A really important part of it is you just want to make sure the veggies are submerged under the water, or mold can grow on them if they're exposed to air. So make sure they're under the water. You can use some sort of a vegetable leaf to kind of keep them under that water. And then just let it sit out at room temperature for a couple weeks. And it'll start to ferment. And the native lactic acid bacteria on the vegetables will just multiply. And you'll realize that it's going to start to have more of this vinegary smell to it, kind of like what you'd smell with sauerkraut or kimchi or any other fermented vegetable. And it's really, really safe. One of the microbiologists at the USDA even said it's probably the safest food technology we have, and we don't know of anybody who's gotten really sick or died from fermented foods. Even though it sounds kind of iffy, but that's how people used to preserve their vegetables through winter. It's really easy. Sandor Kotz, if you want to learn more, he has a really great book out on how to ferment foods, or you can just Google some recipes. I usually recommend that if people want to start incorporating probiotic-rich foods, which is appropriate for almost everybody, I recommend starting with the fermented vegetables, just because they're a lower sugar option. Some people, the amount of sugar in the kefir or kombucha, they do react to it. So I've had a couple, clients and friends who have drinking maybe a bottle or 2 of kombucha a day and have gotten really itchy skin. So it's just the sugar and the yeast, they don't do well with it. But sticking with the lower sugar foods will also give you some fiber, so these vegetables. And Bubby's brand is a really great brand if you're looking for it. Or if you go to any of the co-ops, they have a section of fermented foods. How much to eat? About 1 tablespoon at 2 to 3 meals a day is ideal. And then if you're able to, trying to get a variety is good, because you're going to get slightly different bacteria strains with every, different type of probiotic food. So if you guys want to learn more about how microbes affect our health, these are some really great TED Talks. And if you have your phone, you can just take a picture quickly of this slide. But it's pretty eye-opening. Alright, so number 6. Thing that could cause our digestion to get out of whack are unhealthy lifestyles. And in particular, we're going to talk about sleep and exercise. So why sleep? Well, you guys probably know if you're not sleeping well, you might be a little bit more stressed. That's pretty common. Or you might be more likely to eat some of those higher sugar foods that we talked about in the first slides, because it's kind of the body's way of trying to get some sort of quick energy because we're just tired. So stress can really affect our motility and things too, and we'll actually talk about that in a bit. This study talks about circadian disruption. So circadian rhythm is just that natural rhythm of sleep-wake cycle. So you guys maybe have noticed if you wake up at the same day every day and go to bed at the same time every day, it tends to get a bit easier to get into this cycle. So that will kind of be considered your circadian rhythm. They found that disruption of this could make intestinal permeability worse. And it also was found to decrease the levels of good bacteria and increase the levels of the harmful bacteria in our gut microbiome. So it's pretty wild how just our sleep and our circadian rhythm, disrupting that, can have such profound effects on our gut bacteria. And then exercise. So certainly being active can help with that motility. So if somebody is struggling with constipation, it's really important that they get some sort of activity in their day just to help that gut motility. We also know that it can help to manage our stress, and we know that more exercise actually increases the amount of bacteria in our gut that produce that short-chain fatty acid butyrate, which is really important for keeping that lining of the intestines healthy, preventing inflammation, and really good for the immune system. So what I recommend to people is just finding some sort of activity that you like, that you're going to stick with long term. You know, not everybody likes going to the gym. Some people love going to the gym because it's their community. I personally haven't been to the gym in maybe 5 years, but I really like doing yoga in the winter, and I like being outside biking and kayaking in the summer. So that's just how I stay active, and it's really easy for me to keep up with it because I enjoy doing it, and it's so good for like my mental health and my stress levels. So I'd say just really think about what do you truly enjoy doing. If you feel like you just don't have enough time in your day to incorporate exercise, I would recommend checking out the 7-Minute Workout app. It's high intensity interval training, and so we know that with high intensity intervals, so you know, it's kind of like getting your heart rate up and then it comes down, up and down. It has really good cardiovascular health benefits, and we don't need to do the exercise as long to get the benefits from the exercise. So this is just 7 minutes a day. You can do it right before you shower. One of my patients last week, I told him about this. He goes, "Oh, everybody has 7 minutes." I was like, yes, that's the spirit. Okay, so finally, I heard a chuckle. Chronic stress. Yeah, this tends to be one of the hardest ones for people, I think. It's not that acute stress issue, it's that day in, day out kind of chronic stress that can really affect our hormones and can affect our gut health. You know, when we're in this kind of fight or flight sort of situation, it can affect our nervous system, which we have this vagus nerve that connects our brain to our gut, and it can really affect the motility of our gut if we're just chronically stressed. There's a study that was done at the University of California, Los Angeles, where they had some young adults with irritable bowel syndrome do yoga twice a week for 6 weeks, and they found that it significantly improved their constipation and their other symptoms from their IBS. So that stress reduction can just have such a huge impact. So this will be another one of those things where just really thinking about what is it for you that helps to decrease stress best. In the Employee Health and Wellness Center, Cami offers this heart math, which is a way to kind of, you know, shift mood, shift heart rate to ultimately decrease stress. It kind of looks at the heart rhythms, and she can do a much better job of explaining it than I can. But I would really recommend checking it out and just setting up an appointment with her, 30 minutes, and seeing if that's something that you think would help you in your day. And then some people find just kind of pausing, you know, turning off electronics for 30 minutes and just decreasing a lot of the stimulation around you can help to get us into that more calm, relaxed state. Doing meditation, we've talked about it, other presentations. You know, everybody's way of decreasing stress is just a little bit different. So let's just do a quick review here, and then we'll have some time at the end for some Q&A. So again, as we go through this review, just kind of think about if anything came up in this presentation that you want to look into further or maybe start implementing. So we talked about that standard American diet, how it's low in those vitamins and minerals and fibers, and how we need those nutrients to make sure our gut's working properly. Nutrient deficiencies can be contributing. We talked about lack of digestive function, so if someone's not making enough stomach acid or secreting enzymes properly, or even just not chewing food well in the first place. We discussed this intestinal permeability, and then the unbalanced microbiome. And with the unbalanced microbiome, we really kind of dove into those probiotic fermented foods and talked about incorporating some of those into the diet, about 1 tablespoon at 2 to 3 meals a day. We talked about unhealthy lifestyles, how sleep and stress can be impacting our gut, and then this chronic stress. So this is just some of the research I pulled from, but there's so much out there. I would say just kind of go to PubMed and search if you want to really dig a lot deeper. And that's all I have for you guys. So we have about 15 minutes now for some Q&A, either about this presentation about gut health or really about anything nutrition related.
When you were talking about the nutritional deficiencies, you were saying mysomething.com as a resource to evaluate whether medications are causing problems. What's the something? I'm not hearing that clearly.
Oh, let me spell it. It's MYTAVIN.
Okay.
.com, and it actually has the references they use to create that as well. I believe it's a doctor that pulled that together.
Can you explain the difference between a probiotic and a prebiotic, and when you use one versus the other? And then I think there was another different term up there with the biotic. So it seems like there's different classes of them.
Yeah, I'm glad you asked that. So probiotic versus prebiotic. Probiotics are the food for the probiotics. So prebiotics are like those fibers, soluble fibers, resistant starches, these things that kind of feed the probiotics. And probiotic is simply a word that means beneficial bacteria. So prebiotics you're gonna get those mostly from eating a lot of fiber-rich foods and just eating a variety of that, because most of those colorful fiber-rich foods have these types of fibrous prebiotics that feed the probiotics. The probiotics are a bit harder to find because you have to actually search them in the store. So saying, I eat pickles, I have probiotics isn't always good enough, because sometimes the pickles aren't truly fermented. But that's just, you'll have to find fermented foods for pickles. They tend to be kind of cloudy because it's that fermentation process makes the brine a bit cloudy. And on the packages, look for live active cultures.
I have a 17-year-old daughter who is probably very similar to a lot of the symptoms you experienced earlier in life. And I think I've got her sort of convinced like there's a lot of connection to her gut and what she's experiencing. She skips breakfast every day. I can't get her to eat. What do you recommend for, I don't like eggs. It makes me feel icky. All that stuff makes me feel icky. It makes me bloat. Try this. I don't like peanut butter. I don't like, so I'm just struggling, like what can I give her? I can probably go look up some of that FOMAP or that diet. Maybe I can get her to eat stuff that's not typical breakfast items, but it's just a struggle. Like you can't skip that and expect your day to go well. And
I get it. I get it. So it's like if you get digestive issues after most things you eat, it's kind of becomes a fear to even
absolutely she's
eat.
There because she's afraid to go out with her friends because she feels like she can't eat.
Yeah, so it's mostly kind of IBS, gas, bloating, diarrhea.
Yeah.
Okay. Mm-hmm. I would say look into that low FODMAPs diet. Try to find a dietitian to help out with it. But Monash University University does have an app that can be helpful, and it's called the Low FODMAP Monash University app. That's where all the research is coming out of in Australia. And it basically, if you type in foods to the app, it'll give you a green light or a red light. So if it's green, it's probably safe. And maybe if she just tries eating that way for a few days, it might help her. But I would then also, seek out a dietitian if that doesn't help. Yeah, because I think what you said about thinking about non-sort of breakfast foods for breakfast could be helpful too. Like, she maybe has a few foods that she knows she tolerates.
Sure.
Does that sound
Yeah.
right?
Yeah.
Yeah.
We probably need to come see you.
Yeah.
Maybe your life experiences should lead you more.
Yeah, I'd love to work with her.
Thanks.
Yes.
I have a question. So sometimes, like, I try to eliminate gluten and dairy because almond milk sits better with me and staying away from gluten stuff. And then I also, like, if I want to eat some bread, I have these little tablets that I take. It's just like solid enzymes, all that amylase and everything ASE for those digestive enzymes. But still, once in a while, those don't always work. And so I wonder, why sometimes and why not always?
Yeah, that's a good question. Do you ever notice that you're more stressed on the days that it's not working, or?
Well, I'm stressed every single day.
Yeah. Okay.
I like this stress, but I've always had digestive issues for as long as I can remember.
Okay.
And I find out and I end up like her. If I don't eat, I'm good.
Okay.
So,
I do.
sometimes not eating and feels better.
Yeah, I do wonder if you have some food sensitivities still that we don't know about, because people can have food sensitivities to almost anything. And the reaction from food sensitivities can be delayed. So you could be eating a food 2 days ago and just reacting to it today. So it can be a little hard to figure out. I would almost with not knowing a lot about you, but maybe consider looking into MRT, which is a type of food sensitivity testing, which has some pretty good testimonials for, or kind of seeking out a more functional medicine provider and see if they can help piece together anything else in your puzzle. Any other questions, comments? Yeah.
So when it comes to probiotics, there are a lot of them out there, and you said it's kind of hitting the tip of the iceberg when it's coming about gut biome and healthy bacteria. Do you recommend any kind of probiotic out there? Like, some say there's 10 million cultures or 40 million, or which kind of probiotics do you want, like lactobacillus or?
That's a great question. So what I usually do with people is if they have a specific symptom or specific disease state, we might do a trial run of a probiotic for a month or two to see if it helps. And what I do is I kind of just look into the research and find which ones have been researched. There's a site called probioticadvisor.com, which some of us healthcare providers will buy access to, where we can easily search for research studies. But for somebody who's just kind of generally healthy, I wouldn't, honestly. I personally don't. I just eat fermented foods just because I feel like we don't know enough, and it can kind of be a waste of money. And the probiotic foods, they have in the trillions of bacteria versus some of those supplements in the billions. So yeah, to answer the question, I would say if there's something specific that we're trying to target, then yes, but if not, then no. Anybody else? All right, well, thank you for coming.